In today's quick video, let's talk about the supplement 5-HTP. Let's dive in. 5-HTP or 5-hydroxytryptophan is actually produced in the body. It comes from the amino acid tryptophan and eventually can get converted into the neurotransmitter known as serotonin. Now, dosage for this one is going to depend on the duration. I've seen long-term dosages around a year for about 400 milligrams. And in other studies, I've seen dosages as high as 1.2 grams, but those studies were for about a 10-month period. Make sure you're talking with your provider to figure out what dosage is actually appropriate for you and for how long. And this is also going to depend on what other supplements or herbs you might be taking or medications. Now, sometimes this one can have side effects such as dizziness, nausea, vomiting, or GI upset. And in other cases where the person is taking something like an SSRI, you can theoretically have something like serotonin syndrome, which is a bad thing. So again, if you're taking any medications, make sure you're working with someone who knows these interactions and can guide you appropriately. Now, the biggest use that I see for 5-HTP is for treating depression. Because 5-HTP crosses the blood-brain barrier, it can often help to increase levels of serotonin, which is generally how most of our SSRIs work as well. They kind of increase the duration that serotonin is hanging around in our system, which is why they're called selective serotonin reuptake inhibitors. So they keep serotonin hanging around longer, and the theory is that more serotonin, the happier or the better mood that you have. And yes, I'm aware studies are constantly changing and constantly in flux, and sometimes we're wondering if this is even the right mechanism for depression, but that's for another video. Another thing we also see with the use of 5-HTP is that in some cases it can actually enhance GI motility. Some studies in mice have shown that taking a long-release 5-HTP supplement can actually help with gastrointestinal transit times as well as motility, so helping people who have kind of chronic constipation or even things like IBS. Now, how do I use something like 5-HTP with clients? Now, this is again one you need to be a little bit more careful with. I tend to use this in people who have things like a low mood, but they're not on a SSRI or any other antidepressant. Again, the theoretical risk of serotonin syndrome is real, and you don't want to push anybody into that pathway. So I tend to add this one in as I'm working with someone with other dietary and lifestyle changes who's had a bit of a low point in their mood. It could have been from chronic stress, and then we tend to cycle them off of this one after a couple of months. Again, dosages vary. I tend to dose anywhere between 200 and 400 milligrams, but again, that number could decrease or increase depending on other factors. All right, I hope that this video was helpful and that you learned something. And if you enjoy this type of video, then you might want to check out these other videos. All right, I'll see you in the next one. Bye.